The shoulder was really causing me a lot of pain every morning. I mean, I just wake up with total pain, and I couldn't do my normal activities like shoveling, picking, even picking up anything with that left arm. Fly fishing, I mean, I couldn't raise it up at all, and just in a lot of aching pain, and lived with it for a very long time. And then it comes to a point and you just say, you got to have something done.
So as I recall, you'd had MRI scan, and there was some talk about you maybe having to have a reverse shoulder replacement instead of an anatomic replacement. You were here in my office looking for another opinion. We decided that it was worth trying an anatomic in your case because you had enough rotator cuff and enough sort of bone left to really work with what you had, and you wanted that higher level of function.
Right. And so you suggested with, doing just the replacement shoulder and doing a lot of repair probably on the rotator cuff.
Right, right. Yeah, and as I remember, your procedure went very straightforward. I think we were in the hospital just one night. Went home the next day. Pain management was, really pretty satisfactory. You recovered real nicely.
Everybody was fantastic. I mean, and they explained exactly what was going to take place, how possibly the outcome was going to be, and if I had any other questions, the hospital was awesome.
Yeah, it really is a team effort. Nobody can do this by themselves. So we've been doing this for 22 years now. I think you have high expectations, right, for what you still want to be able to do.
Exactly.
And that's really our goal, is to try to return you to that place where you can be confident that you can do what you want to do.
Right.
Continue to see something.
Yeah, and I feel it every day. It feels stronger and stronger, and different things that I can do is awesome.
It is really gratifying for me to see, you return to, especially fishing, right? Because we share that passion.
Exactly.
That's one of the things that I look at and say, if it were me, I wouldn't want to be suffering out there on the trout stream. I want to catch the fish and not be bothered by the shoulder pain. So I can kind of, I guess I relate to that real easily. But I'd say that's the most rewarding part of my job is looking at people who come in to the office suffering, dysfunctional, can't do the things they want to do really. And then 6 months later, they're coming back in saying, I can do that stuff now. That's really rewarding. That's I think one of the great joys of orthopedic surgery is seeing patients get back the kind of function and the activities that they really love.
I just have to thank you to the bottom of my heart for what you gave me.
I'm thrilled to see you happy and back out there doing the stuff you love.
Yep.